Born from the San Antonio community spirit and molded by almost 140 years of experience, Clarity Child Guidance Center knows firsthand how much time and hope can heal a heart. Clarity is the only nonprofit mental health treatment facility in South Texas which specializes in children ages 3 to 17, treating over 7,000 children annually. Our 8-acre campus in the medical center provides over 25,000 behavioral health interventions per year, including crisis assessment services, inpatient and partial hospitalization, and outpatient therapy. The kids that we see and the families that we see are often going through the most difficult situations of their life. I often think of the quote from Frederick Douglass that it's easier to build strong children than repair broken men. And that's what we do here at Clarity. We have a window of opportunity to provide intense intervention and change the trajectory of a child's life.
Not too long ago, I fielded a crisis call. She was a 21-year-old who had been denied at another hospital here in the medical center, and she had called just extremely distraught. I stayed on the phone with her. I just got her to get here. She said, I was here once when I was 17, and I felt safe here. What we did in that moment when she was a teenager stuck with her over years, and we got her to where she needed to be.
Despite our size and the number of services that we provide on an annual basis, a lot of our systems are still very antiquated. The patients that we treat have to fill out a huge stack of paper to create that record of engagement, and our assessor is leaving the room, printing out paper, signing it, and scanning it back into an electronic system.
Here at Clarity, we do approximately 3,800 discharges per year, and these families are getting 12 to 15 pieces of paper. This really hinders us from seeing a lot of the patients that we can potentially see in our community because there's only so much we can do in a day.
Looking back the 5 fiscal years that I review, we've had about 590 patients and families that have walked through our doors that just could not wait for our intake process. The longer the patients are sitting and dwelling and waiting, their symptoms can exponentially get worse. So I think the more resources we can gather at the front end to allow these families to get expedited as quick as possible leads to safer outcomes.
If awarded a grant from Impact San Antonio, the funds would go directly towards purchasing a variety of computer equipment, including 11 computers on wheels and 64 mobile tablets that would allow our clinicians in real time to document and create an assessment. So we're spending time face-to-face with the families that we're treating and not in front of a computer doing data entry.
Our team was able to run some numbers, and last year we conducted 5,600 assessments, which would have saved us 84,000 minutes if we had mobile technology devices.
A case that touched all of us here at Clarity pretty deeply was a young child who unfortunately lost a parent to suicide while they were here with us in the facility. And so we were able to dedicate the time to his treatment to get him established in another home, and he's now thriving.
Working at Clarity has really taught me how we are as children is how we grow up to be as an adult. Mental health does not discriminate, and it's not just one portion of a community, it's everybody. And so that's why this work is so vital. We want to take care of our kids so that way we have a bright future ahead of us.
Today, you have the opportunity to give our children, families, and staff the gift of time. By investing in technology upgrades for all of our programs, you can expedite treatment for young people who are going through the roughest experience of their lives. We know the work at Clarity Child Guidance Center is life-changing. Together, we can offer the same trauma-informed care more quickly and efficiently, serving more children and families year after year.